healthcare law, it is not included, no? But it is necessary in terms of being new. We need some technical assistance to be implemented in the universal healthcare. So when we say technical integration, it is the integrated delivery of population and individual-based services across the continuum of care that involve different stakeholders, no? Different providers within the province or citywide health system. Okay? And remember, pag population, population-based, it will be handled by the public health. So immunizations, healthy lifestyle, smoking cessation, but individual based is usually a public-private mix. No? Technical integration also drives the need for different clinical and non-clinical providers to coordinate and cooperate in delivering care. So very important ang kaya may mga clinical practice guidelines. For example, uh, what will be the guidelines in terms of TB right now. So, for example, during that time, the gold standard is the DSSM, no, direct sputum smear. However, now is on the MOP6 is now as a screening. We can now use chest X-ray and gene expert as the gold standard. Okay. So the technical integration will focus on clinical and public health integration. So in the event that there will be, for example, in private hospital, in a private hospital, 10% of the bed capacity will be provided as basic accommodation for the universal health care. Pag naman public hospital, baligtad, 90% for the basic accommodation. And kapag ikaw naman ay, what they call this, when you are specialized like AVRMC, 75% of the bed should be on the basic ward accommodation. So in the clinical integration, there should be an ability to provide comprehensive set of services from primary to palliative through established system or referral. Primary care at the core, acting as the coordinator and navigator of patients throughout the integrated system. I think we are doing some pattern in US and other areas or Canada, no? Or we are done with your reporting in the health system. For example, even before they go to the specialist, there is a primary care physician that will serve as the coordinator and navigator in this integrated system. So it's the public health unit as head and source of orders where directions are emanating from. So if you will look at this in the fragmented health system, yung primary healthcare, parang inilalagay nila lang doon lang sa mga peripheral, no? But in the integrated delivery networks of the primary healthcare, integrated siya. So, ibig sabihin, even if you are in a specialized medical services, meron pa rin siyang primary healthcare component. Okay? So, hospital, laboratory, hospital. So, para siyang web na nag-i-interlink. Unlike ito, na parang kaya nagkaroon ng wala akong pakialam dyan kasi sa mga rural areas yun. Okay? Pagdating naman sa public health integration, which is very important, there should be a community participation. Community-based health and health-related interventions for better health outcomes. Next is active surveillance. So there is disease monitoring and community diagnosis through epidemiology surveillance unit. So unique in Tacloban is we have the volunteer surveillance officers, no? And then protocol standardization. So dapat standard talaga yung protocol, both the clinical and the public health standards. Kasi ito yung problema, dapat hindi pare-pareho. And then this one is the health promotion, which we had launched it before, no? Healthy living, meron kang mga, for example, ano ba ang look ng isang healthy school, no? May mga settings siya. And then community health resilience through functional disaster risk reduction, DRRM. disaster risk reduction and management system. And another is strategic investment planning. LIPH stands for local investment plan for health that should be comprehensive and respected.